revising the content related to the base of the skull, emphasizing on this particular bone, identifying the outline or parts of this particular bone and the foramens which are present to it. So, this particular bone is commonly given in an examination, and the exam question usually rounds about identifying the basic parts. So, whenever you are given this particular bone, you should be able to identify this bone as a sphenoid bone. This particular bone, sphenoid bone, has a basic part which has a body, central part has a body and two wings. One is big wing and one is small wing. We call them as greater and lesser wings of the sphenoid. The body has two parts, basically upper part, lower part, but it has anterior surface, posterior surface, inferior surface as well. But we emphasize this particular superior surface of the body having this particular bony chamber in it. We call them a sella turcica. So, you should be able to identify the sella turcica, and having identified this sella turcica, you should be able to identify this particular sella turcica which holds this particular cavity in it, which lodges the pituitary gland in it. Now, after that, you should be able to identify this particular bone having some kind of like a projections which is projected downwards. We call these projections as pterygoid plates. There are two pterygoid plates are there as such. We cut a section. There are two such projections are there. We call them as pterygoid plates medial and pterygoid plate lateral. So, these are the two pterygoid plates that is present to it, which should be able to identify medial one is a skinny one and the lateral one is a flatter piece of bone. Now, whenever given to these particular cut sections of the specimen with this calvaria out to look into the base of the skull, you should be able to identify this particular sphenoid bone placed in the central part and having the wings spreaded to the front side and the back side as well. The back side which has got like a greater wing along with this communications with this particular bone which is called the petrous part of the temporal bone, and this is a lesser wing which is merging with the anterocranial fossa with the frontal bone or orbital plate which is present in this region. So, this particular bone which looks like a bat, spreaded wings like that, which hold some cavities to it. So, this particular cavities can be asked given to the bone itself, identify the foramen and what structure passes to it, which is synonymous with the base of the skull as it is. Like that, whenever you are seeing these particular structures like this, you will be able to identify this one which is having optic foramen, which is present over the optic canal, which is passing through this particular optic nerve like this. So, this particular optic canal which should be able to identify that. Again to it, superior orbital fissure which is present in here and is present in here base of the skull as well. In this particular middle part of the greater wing, we have this particular Foramen Rotundum, Foramen Ovale and Spinosum as well. And this particular region we call them a sella turcica. Along with that, we have a pituitary in it, and side to it we have two cavernous sinus, right side, left side cavernous sinuses to it. So, these are the things that you should be able to identify whenever given to the individual specimen. Don't dig deep into it, just know the special features which this particular bone has. Two of these particular wings, central body, and the downside projections we call them as pterygoid plates, medial and lateral pterygoid plates, and it has number of the foramens. And this particular sphenoid bone brings us to this particular foramens that we have learned and revised. This particular foramens which are present in the base of the skull whenever this particular upper part of the skull is removed, and we identify the foramens in these particular regions. So, we have identified this particular foramens, given these names to it. We have this particular like cribriform playpoid, optic canal, superior orbital fissure, foramen rotundum, ovale and lacerum. And then we have the spinosum, little extreme to it, and posterior side we have this internal acoustic meatus which is having this little bit like a inner side to it. Then we have the jugular foramen which are close by this particular foramen magnum, and inner margin of the foramen magnum we have this hypoglossal canal which is exiting 12 cranial nerves. So, you should be able to identify this cranial nerve which are exiting in this particular or through this foramen. This particular picture, whenever you have the similarities or exact similar thing, whenever this particular cadaver you are seeing, once this particular brain is removed, which have two of them are removed. Now, this particular foramens can be tagged in cadaver as well. So, putting this particular needle and thread into it, We can ask you about identify this particular foramen, identify this particular nerve or structure that is getting out or coming through this particular foramen. So, which are again this particular thing. So, in any ways we have to memorize this particular charts about what are the foramen name of it, what are the contents that is passing through it, and this particular basically covers this particular bony part or osteology part of the brain. Along with that, you should be able to identify the salient features or general features of this particular cranial bones like sphenoid bone, as we have mentioned, the process and this particular element, and as well as this foramen which is passing through it. Mandible, you should be knowing the individual mandible, each and every part of it, and the content of it. So, we revise this particular again and again so that you can understand these are your exam questions. So, you should be able to identify this particular foramens and you should be able to identify this particular content which are passing through it. Identify the nerve first, then you go for this particular neurovascular structure along with that which are coming in it. And in the mandible, there is no excuse on mandible, you have to learn the mandible in and out, whatever the contents is there within this mandible, related to the muscle attachment, related to the nerves which are passing through, related to the joint which this particular mandible participates, and this particular mandible holds this particular region which has got importance related to this particular floor of the mouth. Now, this particular norma basalis, as I have said, it has got three parts: anterior part, middle part and posterior part. Just like know this particular different parts which is present in it, these are the anterior side which is having this particular norma basalis anterior, which is having this particular palatine bone and this particular palatine process of the maxilla making this particular region, and this particular foramen, you see this incisive foramen which is present in the midline to it. Then on the back side of this particular norma basalis anterior part is limited by this opening, we call them as squena or posterior nasal opening. That means we breathe through the mouth or breathe through this particular nose, external nose that goes to the canal, we call them as nasal cavity, then it comes out of this particular region, we call them as posterior nasal opening, which is known as choanae, posterior nasal aperture or choanae. So, this particular choanae leads to this particular air to this particular common tract of this oropharynx, laryngopharynx, then it goes to the laryngopharynx to the lungs, subsequently gets ventilated. Now, this particular midline, we have this particular nasal septum which is separating this. We have this particular two bones making this particular nasal region. We have this perpendicular plate of ethmoid and we have a vomer. Two different bones are present in this midline. So, we have a class on like nasal cavity and the nasal septum. Will come into this particular formations of the nasal septum, which is partly formed by the cartilage, partly formed by the bones. Bones which are forming this posterior part of the nasal septum, anterior part of the nasal septum is formed by the cartilage. We call this septal cartilage, and posterior part is formed by the two pieces of bones. We call them as perpendicular plate of ethmoid, and even posterior we have a piece of bone, we call them as vomer, V-O-M-E-R, vomer. So, we will talk about that in other whenever you are going to talk about this particular nasal cavity nasal. Now, then after this posterior nasal opening to this particular point over here, we call them as like a middle cranial fossa, a middle norma basalis. So, choana to this particular thing over here, we call them as pharyngeal tubercle. So, this particular bone that you are looking here is occipital bone. This opening we call them as magnum. These are the articular part or articular fascia, we call them as occipital condyles. Now, in the midline of here we have a bony piece which is projecting out, bulging out, we call them as pharyngeal tubercle. So, this particular pharyngeal tubercle, why this is called pharyngeal tubercle, which is present in the skull bone? Because the muscles of the pharynx are attached on it. You know the pharynx which is present in the neck region, muscles of the pharynx are anchored into this particular tubercle, bony tubercle. As it is anchored to this particular bony tubercle on this occipital bone, this tubercle we call them as pharyngeal tubercle. Again, this particular thing is important for us to identify in examination. So, this particular tubercle which is present anterior to this particular foramen magnum, this is posterior side we have the protuberance, posterior occipital protuberance. Anterior to it we have a bony midline projections like this. Every one of them we have this particular projections. So, if you just like flip it, anterior to it we have a midline notch, we call them as pharyngeal tubercle. Now, if the examiner touch about this pharyngeal tubercle, they ask you about pharyngeal tubercle, identify this notch. Then if you able to identify this pharyngeal tubercle, that leads to the muscles of the pharynx. Then they ask about pharynx, then they enter to the pharynx. So, name the muscles of the pharynx which are present. So, we have the muscles in the pharynx, we will going to learn, we call them as constrictor muscles of the pharynx. We call them as longitudinal muscles of the pharynx. There are two different types of muscles are there. Some of them are vertical, we call them as longitudinal. Some of them are circular, we call them as constrictor muscles. So, constrictor muscles of the pharynx are anchored to this point. We call them as pharyngeal tubercle or pharyngeal raphe. So, we will talk about that. But again, pharyngeal tubercle in this point is important for identifications of this bony identification, and if you able to identify, you lead into or land up into the pharynx. Then muscles of the pharynx, different types of pharyngeal muscle, then nerve supply to it, etc., etc. You just like that. Now, this particular region, which is this middle part of the norma basalis, and it has a lateral part, medial part, which has got like wings of the sphenoid, and as well as this lateral pterygoid plate, medial pterygoid plate holding this particular regions. And as well as little bit on the lateral side, we have the same things, the styloid process, mastoid process, stylomastoid foramen. So, these are the things that we have already have covered in this particular regions, and optic carotid canal or carotid opening of the carotid artery which is present in this region. So, these are kind of like the things leading to that particular part which is known as like the foramens which are present to it. Then we have this particular posterior part which is like posterior part of this particular region, which is related to this particular occipital bone, which is having this particular thing, posterior occipital or external occipital protuberance, condyles over here, and then this particular foramen we call them as condylar foramen, etc., etc. These are the things that is present to it. So, these are the parts of this particular like posterior part of this bone. Now, coming to this particular like plates over here, pterygoid process that we have mentioned here is which is a part of the sphenoid, which has two parts, right? We have a medial part, we have a lateral part. We call them as lateral pterygoid plate, medial pterygoid plate. So, lateral medial pterygoid plates which are present along with this particular sphenoid bone which is having here, and this particular thing is kind of like rolled over here. We call them as hamulus. These are kind of like rolled. You see that little bit swelling is there, just like it's having some kind of like a depositions of these particular extra calciums are there. We call them as hamulus or hamulus. So, these are the things which is present in this particular pterygoid process or pterygoid bone. And greater wing, we have the spines of the sphenoid. Spines of the sphenoid sometimes been asked in previous days. It has got importance. The spine of the sphenoid, which is related to this particular point over here, we call them as this area spines of the sphenoid. If you have identified the sphenoid bone, so this point where I am holding in this region, we call them as spines of the sphenoid. Just a rotundum lateral to that, we call them as spines of the sphenoid, which is corresponds to this particular point. Now, the spines of the sphenoid like were like having an exam importance, because we have a nerve related to this particular point, like along with this particular foramens which are there. But nowadays we just like restrict to this particular like parts of the bone, sphenoid bone, like greater wing, lesser wing, body, and processes, lateral process and medial process, which are known as pterygoid plates. Now, these particular pterygoid plates, body and wings hold this particular different parts of the sphenoid bone, and they hold number of like a foramen series to it through some structure goes to it. So, if given to this particular examination with the sphenoid bone to catch and then identify the parts of it, quickly identify the parts of the bones like this. So, what bone it is, and show me like a greater wing of sphenoid. You show the greater wing of sphenoid. Next question comes like what are the foramens you can identify, visible foramen you can identify. If you identify one or two, they will just like ask you, alright, what structure passes through it. If you are able to identify the structures, name of the structure, say for example, you identify like alright, this is Foramen Ovale and it transmits some kind of nerve. So, it has transmits mandibular nerve, right, mandibular division of trigeminal nerve. Well, then question asks, alright, what are the other divisions of trigeminal nerve, which are three of them, right, ophthalmic, maxillary, mandibular, like that. Alright, then you can identify, okay, these are the, what kind of nerve it is, like mixed nerves, sensory nerve, motor nerve, likewise. So these are the kind of questions that is coming, like usually during examination. This is how these things builds up, and then they can go down to the maxillary divisions, like what these particular mandibular divisions, what these mandibular divisions actually do to us, like in help in what, like fate of the mandibular divisions. If you can answer beyond that, they can ask about that, like that. But again, going back to this particular thing, simple form of things, that these foramens, all of them need to be identified. That's a must have thing whenever you are showing up for the examination. Once you identify the foramen, then you should be able to identify this particular transmitting structure going through these particular regions. So identify the different foramens in different specimens. Two of these particular regions are there. Individual sphenoid bone, you have to identify this parts of the sphenoid bone and the foramens within the sphenoid bones, that also you have to identify, because that leads to the questions beyond that. So coming back to the again same questions, middle cranial fossa, sella tubercular setup, hypophyseal fossa, these are the things, and these particular regions, and finally to this particular part, the cranial nerves which are passing through them. So this is more or less our osteology class of the head, neck regions. The laryngeal cartilages, laryngeal bones, we do not teach detail of. So you do not have to learn about the laryngeal cartilage detail of it, only the names of it you have to know, the hyoid bone, thyroid cartilage, arytenoid, etc., etc. So you will be learning that in larynx lectures. But as far as gross osteology is concerned, we focus into these particular regions along with this mandible, along with these particular like salient features of the zygomatic bone, like zygomatic bone processes, zygomatic arch, etc., etc. These are the things, and mastoid bone as well, petrous part, squamous part, that part you have to identify, the stylet process, that part you have to identify, temporal plate of them, that these are the things, and the foramens which are present in the undersurface and as well as into this surface as well.